Hi, my name is Malay Shah, and I'm the Surgical Director of the Liver Transplant Program at the University of Kentucky. I want to thank the journal for the opportunity to provide a brief overview of our manuscript. Liver transplantation has become the gold standard for patients with hepatocellular carcinoma within Milan criteria in the setting of cirrhosis, with long-term survival similar to patients receiving liver transplant for non-HCC indications. Liver-directed ablative therapies have been used to control HCC tumor burden while patients await transplantation. The number of patients in need of transplant has continued to rise and unfortunately has far exceeded the supply of deceased donor livers available for transplant. Due to this increasing waitlist demand for liver transplant, determining optimal groups for transplant is critical. It is well known that elderly patients have poor postoperative outcomes due to comorbid conditions and frailty. Considering the effectiveness of ablative therapies for HCC, we sought to determine whether elderly patients had a survival benefit over liver-directed therapy alone. The ACS National Cancer Database participant use file was used to select patients greater than or equal to 70 years of age who received a liver transplant or ablative therapies alone for stage 1 and 2 HCC. Baseline demographics, Kaplan-Meier survival curves, Cox proportional hazard models, and propensity score matching were used. We identified 2,377 patients in the ablative therapy alone group and 214 patients who received liver transplant. The 1, 3, and 5-year survival was significantly higher in the liver transplant group at 86%, 81%, and 70%, while it was 82%, 51%, and 31% in the ablative therapy alone group. Age was associated with a yearly 3% increased risk in mortality. Propensity match analysis continued to show a significant survival benefit for elderly patients receiving liver transplant compared to ablative therapy alone. In a resource-limited environment where the supply of donor livers is insufficient to meet the demand of the liver transplant waitlist, it is important to identify patients who will best benefit from liver transplantation. Despite age and associated comorbidities long known as risk factors for poor outcomes following surgery, liver transplantation appears to have a survival advantage compared to ablative therapies alone and should continue to be offered to medically appropriate elderly patients with liver cancer. Thank you very much.